Side question for hip, set 4. Side question number 1. In patient who undergone transtrochanteric approach, THA, discuss the potential disadvantage of in patient's recovery, explain and elaborate. So, patient may experience a longer not weight bearing treatments. So, also, since transtrochanteric approach is done with the abductor muscles, patient may not move or walk or ambulate because during ambulation we have a normal gait wherein our hip would slightly abduct, so it might hinder the patient's treatment or recovery. Side question number 2 and following side question number 1, what barrier, physical, personal, environmental, if any, might hinder the patient's recovery? Environmental, for me it would be environmental because there, if considering that the patient may have post op outpatient, so the patient may experience an environmental changes. Let's say there would be an uneven surface during ambulation, so it might hinder the treatment of the patient. It might hinder the patient's recovery because the pain might aggravate during the ambulation on uneven surfaces. So side question number 3. Side question number 3, what can you what can you activity modification you can recommend to cater the patient's post-op precautions? So in during the post-op precautions with the patient, we can let the patient sit on a low chair that might also no, hinder the recovery of the patient and might aggravate with pain and irritation on the incision site. So, in modification, patient may not sit on a low chair. And next, he could only sit on a shower chair, which is recommended for the uh, hip operated patients. So it might be a higher, not a higher chair or higher shower chair, not a low seating chair. So that's all.